Well, thank you everybody for joining us. We know it was super short notice, but we wanted to make sure you all had an opportunity to speak with Jennifer Strohecker from the Department of Health and Human Services, right, Jennifer?
Yep.
The new department, but wanted to make sure you all had an opportunity to join to hear a little bit about the upcoming changes that are taking effect end of the week or next week, Jennifer?
They're starting on Monday,
On
actually.
Monday.
Yep,
So
April 3rd.
we'll have Jennifer's going to present for about 30 minutes, and then we're reserving some time for the second half of the hour just to answer questions. So I'm going to go ahead and turn the time over to Jennifer.
Yep, that's great. Thanks, Casey.
Thank
Hi,
you.
everyone. Jen Strohecker here. I'm the serving as the Medicaid director for the state. Also, my other title is the director of the Division of Integrated Healthcare. So my responsibility is to oversee our Medicaid program, our CHIP program, as well as substance use and mental health and the state hospital. So we really appreciate the time that we have with you today. Thank you so much for joining the call. We have important changes happening on the Medicaid program, which many of you may be well aware of, and we're really happy to be here today to spend time with you, to go through some of these changes with you and answer any questions that you may have. I am joined today by Melissa Aitken, who works on my team. She has been a very integral part of our ground support strategy. So as we are getting ready to launch our PRISM system and go live, Melissa is readying our staff so they're ready to support you in all of that work. And she's going to help me today by taking some notes and making sure that we've captured all your questions. And if we need to respond back, we will respond back to you via email or something. Just for the purpose of this meeting, if we could, when you ask a question, and we certainly are going to open time for Q&A at the end, if you would mind putting your question, if you could, in the chat. So, and also if you have your contact information, we're going to try to go through these with you. I'm also seeing if another member of the team can join. Oh, she needs the passcode. So that she can answer some questions as well. So I don't know.
Jennifer, I can put that in the chat
That'd
box.
be great, Casey, if we could do that. I'm going to have another member of the team join here just to support. But I'm going to start with an overview. So first of all, this is a big change for our Medicaid system. Thank you, Casey. Let me just get the passcode here.
I can send it over to her,
Would you send that over? Thank you.
Yep.
Okay, great. So this is a big change for our Medicaid system. We have been working for almost 10 years to on this project, and we are days away from going live with this really important work. I'm going to share my screen and just go through a slide deck of what some of these changes.
Jennifer, looks like you accidentally muted yourself.
Oh, weird. That's strange. It's saying I'm sharing audio.
We can hear you now.
Yeah, but when I put on,
if you do it's probably if you do any videos, it'll show the audio.
Yeah, I don't think I have a video. Are you able to see the screen?
Yes, we are.
Okay, that's great. So what is PRISM? PRISM stands for the Provider Reimbursement Information System. And if we want to just look quickly at, we're going to just run through some of these slides because it's kind of an overview of the background, our timeline, and then we really want to invest our time in the changes that you're going to see and experience. We want to help you understand why they're important to you and what you need to do to be ready for these changes. So great. I see that Shandy joined. So thank you, Shandy, for joining too. Okay, so let me start with a little bit of background. So Utah Medicaid is replacing our current MMIS and MMCS claims processing and all of our provider management system. The new system goes by the name PRISM, and you see the acronym stands for Provider Reimbursement Information System for Medicaid. So what we've called all these years MMIS is now called PRISM. This is a 10-year long project. We have gone live with a little piece of it back in June of 2020, which was our provider enrollment piece. We called that C1. We are going live with the rest of the system on April 3rd on Monday. So the rest of the system launch, it's a significant lift. It impacts many of the system functions that you see today. And that's what we want to walk through with you. So the remaining pieces that are contained in our go live for Monday include some of these here. First of all, our managed care processes will all flow through this new system, as well as prior authorization, member eligibility, claims adjudication, as well as claims payment. The member web portal will look and feel different through our PRISM system, as well as a tool called Audit Studio, which is our fraud and abuse system, which is something that you may not be as public facing. But if you look at this list of items that are updated with our PRISM system, it is the bulk of what you use to do your work in our Medicaid program is being updated in our new system. Okay, so we'll go through some examples of how these changes will affect you as a provider. So first of all, claims. Okay, and claims. One important piece, and we hope you've seen our communications that we've sent out over the last year, but the first piece is that we are going paperless. So with this new system, we will no longer be able to submit paper claims. One of the benefits of our PRISM system is while you may use a third-party processor for your claims, which you're certainly able to continue doing that, you can also directly submit your claims into our PRISM system online. And when you do this, when you go in and submit directly into the system, you are actually able to see real-time adjudication. So you can then see what your claim status is. You can also create claims adjustments right there in the system. So it's more real-time. It will give you flags and edits to show you why your claim may not process, or if you need to update and change. You can do that with immediate adjudication results. So certainly this is a big step in modernizing our current system from the claims processing standpoint. You can also check claim status online and get alerts and notices as to what that status is. Again, we're keeping this higher level. We have resources that support all of the detail, and we can certainly take questions as well. But this is just high level, the changes that are occurring. Prior authorizations. You or your staff may be submitting prior authorization requests to the fee-for-service program through a faxed system. Again, we are going paperless. So prior authorization will be submitted electronically directly into the system. This will be a much more efficient process than what you've been accustomed to. You will be able to actually submit online. You can enter them directly into the portal and actually update them, modify them, and see the status of prior authorizations requests right in the provider portal. So that will be a great enhancement to some work that I know was kind of paper heavy and a little cumbersome in our current system. If any of you are doing work for our waivered population, those who are on our long-term services and supports or home and community-based services that also have care plans, these again are being modernized and moving from a paper process to a pure electronic process. So these will be moving, care plans will be fully digitalized, they will be built into the system. The authorizations will be generated automatically in the system, and the care plan approvals as well. So again, we're really looking forward to the automation that is coming with this update on Monday. And we certainly are going to share the links and resources you need. If you haven't gotten a peek into what these look like and how they'll affect you or your staff, we will give you resources and tools. And maybe Melissa, you can start loading, if you don't mind, like into the chat, some of the links for at least our training resources, so you can have that. We do have robust training resources. So why are these changes important to providers? And I think it goes without saying that a web-based support system that provides you like an online real-time feedback certainly beats the paper-based system that you have experienced with Medicaid now. We can provide a much more streamlined and efficient process to submit claims and submit authorization requests and get immediate feedback on that. You're going to see that this is much more user-friendly than what you've been accustomed to. We understand you've gotten used to the MMIS systems, as our teams have as well, but we know that you will like the enhancements that you see with the user-friendly interface. The other piece too is that our older system was built 40 or more years ago. As a result of that, there's a lot of silos where the data doesn't share as effectively as we know it can. And so we're excited now to have a consolidated system with automated processes that really make working with Medicaid much more efficient for you. So you can actually log in there in the chat. I see Melissa has loaded those links. Also, last bullet, we mentioned this direct provider data entry. It does provide you a variety of options to enter claims. So as you're billing, it's just going to be much more real time and user friendly for you to do things in our system than what you did previously. Okay, so this is a little bit older of a slide deck. So I'll just note when it says, what do I need to do as a provider? We will share this slide deck and I'll have Casey distributed out to all of you so you can have a copy of this. But our resources are really important for you to familiarize yourself with over the next, period of time as we transition into our new system. We have Melissa already shared the hyperlink in the chat that goes to medicaid.utah.gov/prism. This has a broad library with an array of resources that have been developed specifically for you. There are training resources, there are information resources that help you see our past system and the changes that you're going to experience. So there's lots and lots of things there. Additionally, you'll see e-learning modules. So we've been running live trainings throughout the last month or two. Maybe some of you have joined those live sessions and been able to see a walkthrough of the program and been able to ask questions. Many of these have been taped and been put online for on-demand viewing. But if you scroll down to the bottom of that screen, you'll actually see really nice, it's broken down into subjects. So if you want to look at claims, if you want to look at prior authorization and many other different topics, that there are topic-specific training resources that you will want to make sure you have that will answer many of the questions that you will have right out the gate on how to use these tools, resources, and what these will look like. Our staff has really benefited from these FAQs, frequently asked questions. Certainly the learning curve has also been for our own staff, as we have 300 some employees that are learning this new system as well. And so we've also developed provider-facing FAQs that will help walk you through some commonly asked questions about our current system, our legacy system, and as we move into the new system, these will really support some commonly asked questions and orient you to why these changes are occurring. One of the things I would like to call out is that our MMIS system and our current our legacy system, which is our MMIS system today, had a lot of requirements that we had in our policy. But because our system was a little bit older, it would allow providers to still continue to bill, even if, for example, you didn't put a place of service on the claim. So our policy, for example, may have said, you always need to put a place of service on a claim when it's billed. Our new system, because it's more modernized and it can capture a lot of those things, it will require a place of service on a claim. So questions like this, like why is my claim rejecting for place of service? Our policy may have always required that you bill a claim with place of service. but our system still let it process even if you hadn't attached it. Our new system is going to require that. So if you're seeing some rejects and you're thinking, why are these claims rejecting, or why are things not processing? I feel like I'm doing it the right way. Our FAQ documents are really helpful resources for you to use as tools and tips to help you facilitate some of these things you'll run into. The last piece is, while many of our providers are on our Medicaid listserv to receive our newsletters when they are released, all of our PRISM resources that we've been sending out over the last at least 4 to 6 to even 12 months are come out through our Medicaid information bulletins. That's the name of our newsletter. And if you are not currently enrolled in our listserv, please sign up so that you can receive updates. All of our newsletters are archived. They are accessible on our PRISM webpage. So you can go there now and see any of the historic items that talked about PRISM and the changes that are occurring, and an explanation of why. So certainly the historic documents have been archived for your reference. But if you want to stay up to date on new things, we really would encourage you to sign up on our Medicaid listserv for these resources as well. Okay, with that, I'm going to take questions, but I want to pause just a minute because I want to orient you to what's happening now. So in our system today, we are in the middle as we prepare for our go live on Monday. We have been in a freeze of our current legacy system. And I'm sure many of you have experienced this freeze, this 3-week freeze that we have been in. I wanted to just talk through that with you for just a moment so you understand why that happened and what's happening right now in the interim. So during this 3-week time frame, we've actually had to take the data out of our current legacy system and move it into our new system. That process has required a freeze of most of our current operations. And so if you're experiencing some challenges right now with getting in, and maybe you're holding claims, for example, because you knew, well, I needed to hold a claim because I know we're not doing payments right now and processing claims. The freeze is in place for that purpose. The activities of moving our data from our old system into our new system have gone very well. The data conversion is complete, and we are doing our post data conversion testing. We are still finalizing some aspects of our system, and the testing is ongoing. Even through our go live date, we will continue testing as we turn our systems on, but we're working closely with our interface partners to ensure that our eligibility files, that our claims processing, everything that needs to go out, even through UHIN to receive your claims, that all those things will function exactly as they're supposed to when we go live on Monday. So what we also want to point out is that while our system does turn on actively on Monday, and you can start submitting your prior authorizations directly into the system on Monday, you can look up eligibility in our system on Monday, that we will process our first claims that we've been holding those claims at your clearinghouse, or maybe you've been holding them. The first claims processing actually happens on Friday. So that will happen on the 7th. And then with that, I hope my date's correct, Friday the 7th, I believe. And then the claims payments will post the following Monday, which I believe is the 10th. So just so you know, the claims have still, we always process claims on a Friday. So our system will go live on Monday. You'll want to submit prior authorizations through that system. You can even begin submitting some claims into the system. And begin getting in, making sure the functionality works. You can look at eligibility, start familiarizing yourself with these pieces. Claims payment and claims adjudication will not happen until our normal Friday cycle, with that payment going out over the weekend for a Friday pay. Okay, so we expect these changes will be significant for providers. And so what we have done to support you in the next few weeks after go live is we are expanding our customer service hours from 7 a.m. to 7 p.m. Monday through Friday for the next 3 weeks after go live. So from April 3rd until April 21st, our phone lines will be open to take your calls. Okay. We also have here an email. We have customer service contacts here, and we have a live email link for you to submit questions directly to us through these emails. So we would encourage you to use the online resources if you can, to familiarize yourself with changes and to prepare yourself for how this will affect you. But certainly, if things are affecting you in your business operations, we invite you to call our customer service lines, invite you to email your requests. We do have our staff are geared to support you with ground support activities. We will work up your questions. We will hopefully provide you ready answers there. But if we are at identifying problems or defects in the system, we have identified a way to really take these questions in from our providers, work them up and put them up the chain and put in fixes in our system. While we've done our very best to identify any problems or challenges that we may have identified through testing, we know turning a system on and going fully live with it will possibly reveal some other things. And so we do have our Prism staff on the ready to take any problem requests or system programming problems that need to be fixed immediately, that we will be working those up as well. So I want you to know that our staff recognizes a significant change to you as our provider community offering care to Medicaid members, and that we want to be able to receive your questions, receive your concerns, and work those up if they come through email, if they come through our phone lines, and provide you with the support that you need. So these are the resource links we would guide you to do that. I will make sure, again, that Casey has a copy of this slide deck so you can have these resources. And certainly Melissa has shared many of those with you in the chat right now. So with that, I'll stop talking and stop sharing for a moment. How can we help you? What questions do we have? I have both Melissa on the line here with me, as well as Shandy, who can help support. Shandy is our director of Medicaid operations. Her staff they're really the frontline staff. When you call customer service with Medicaid, her staff is who answers these questions. She is also in charge of provider enrollment. So if you're enrolling as a provider or running into problems with your provider enrollment, it is her staff that's reviewing these requests and working them up. So we would invite you to put any questions that you have in the chat right now, or you can simply raise your hand and we're happy to take those for you. So thank you for your attention. No direct questions yet. I'm going to just, while people are, yeah, go ahead.
My name's Sabrina. I'm a nurse practitioner in Price. So you're going to turn, I don't really understand how it all works. I'm wondering if, because of your guys' new system, if we have to reach out to our third-party biller and have them reconnect to your new system in some way. Is that a possibility? Like, what are you guys thinking on your end with that?
Yeah, we've done interface testing with numerous third-party billers, Sabrina. And Shandy, I don't know if you're still on the line and if you can assist with that, but we've been working directly with many of the, like UHIN, for example. I don't know who your third-party biller is, Sabrina, but we've done interface testing with them over a long period of time now to ensure that the claims could be shared post go live. Go ahead, Shandy.
Yeah, thank you, Jen, and I appreciate the question, Sabrina. Are you currently using the UHIN?
No, we use Cario.
I'm sorry, who was that?
Cario. It's called Cario.
Okay, so they would have had to be connected to UHEN in the past because they're the only clearinghouse at the time that could basically transfer the information from one system into our system. And so your third-party vendor would have had a subcontractor, a trading partner number with UHEN. And you could check with them and make sure that they are enrolled in the system, because we will allow other clearinghouses to connect with us if you want to keep that relationship with your vendor connecting to UHEN and UHEN staying in our system and just having that relationship. That there shouldn't be any issue with that. And I don't believe you would have to disconnect to reconnect if you're going with that flow. But if you do want to eliminate the middleman of UHEN and just have your clearinghouse connect directly with us, then you will need to go through a few more steps, in our provider enrollment and electronic data interchange group could help support you with that transition. In my opinion, it's probably just as easy to leave it as is, but I don't know if it's a cost prohibition for you. So you could check into that with them first.
Thank you.
Thanks, Shandy. Thanks for the question. Are there other questions we can help you with?
I have a question.
Yeah.
Yeah, so
Hi, Dr.
my
Jackson.
name is Ryan Jackson with the Utah Health Policy Project. So we have tried in the past to sign up for a non-provider provider identification number so that we can get access to the Medicaid status lookup tool. We do not charge Medicaid for any services. We do not provide any medical services. We just sign people up for Medicaid. And right now we're having to use one of our partners' access to look that up. So I'm wondering if the process to sign up as a non-provider provider to get access to that will be any easier under the new system.
Shandy, do you want to walk through the provider enrollment process? And I know, Ryan, we've talked about this historically to get you access to the system, but go ahead, Shandy, if you want to just talk through the provider enrollment.
Sure. I think there's probably two pathways I could go down with this one. One is I think we would still need to connect with a couple other people, Jen, just to validate what the process would be for a non-enrolled provider. We've used some dummy NPIs in the past. I don't know if that's still the case with the new system. So if we could just check on that, I'm not quite sure how that's going to play out. There's also another pathway you could go down if you do choose to enroll as a Medicaid provider. That doesn't necessarily mean that you're held to any requirements to submit claims or become a Medicaid provider. Just being known to our system would allow you that access. You don't have to have a continuation of billing or payments going through. That might be a choice that you want to make. But I think if you want to stay where you're at in that relationship or business model, we should probably take that one back to Jason, Jen, and just get clarification.
That would be great. Just let me know. And I'm happy to get on a call with Jason or whoever.
Yeah, no, it's a great question. And I think we may have others asking similar situations. So yeah, thank you.
All right, thanks.
That's great. Yeah, thank you for the question. Okay,
I
did receive
have a question.
Oh, sure. Go ahead.
Just real quick. So I didn't get a lot of information previously. So I have actually been submitting some of the Medicaid claims. Did I need to not be doing that, or do I need to resubmit them after the April 3rd date?
It looks like I'm the hot ticket on this call today, huh? If you've been submitting them and they're going through electronically, correct?
Yes.
Not on
Yes,
paper.
yeah.
Okay, good.
Right.
Electronically.
Through the portal.
Yes, thank you. They will be held. So you should not have to resubmit. The
Okay.
clearinghouse should have those in their repository, and then they'll release those packages of claims once we
Okay.
hit go live. Yeah.
Perfect. That's what I needed.
Thank
Thank
you.
you.
Thank you, Robin. I do see a question in the chat I'll just address. This is Wilma from the Dental Center in St. George with a question around the eligibility lookup tool and if it's still available or if the provider code check tool or does it need to be checked in PRISM. These are great. These have been resources that I know we've had in our legacy offerings. And I have good news is that the eligibility lookup tool will still continue outside of PRISM as well. So that piece will exist. The one change we are making, and Shandy, help me remember the exact name. I think it's Access Now.
That's correct.
Okay, yep. We are on April 3rd turning off where you call in to get eligibility for Medicaid members. And it's called the Access Now, but it's where you call in and you're able to do it over the phone. That system will be turned off when our PRISM system goes live. But our eligibility lookup tool will still function. Go ahead, Shandy, is there another piece?
No, I think that's right to the point. I mean, if anyone is using the phone system, you could still call into it, but it's going to redirect them to the eligibility lookup tool. And I think that is actually a little more helpful because there's additional information that can be provided that isn't always readily available through the phone lines.
Yeah. So I think that's important for staff who may be using that, just to know that the eligibility lookup tool itself is what you want to use as your eligibility resource. The other piece around the coverage and reimbursement lookup tool is an important update. That has been a very handy resource for providers to go in and type in a code and look at coverage. You will note today that as you log in and look at the coverage and reimbursement lookup tool, that there is a red text banner that says that this particular tool will be frozen after, I believe it's like March 13th, and that the policy and the information in the tool as it exists today is going to be archived. It will still be accessible for claims that were billed previously, but it's used as a resource, and there is a timestamp that says that after March 13th, you will need to use a new coverage and reimbursement lookup tool. There is a small delay in our new coverage and reimbursement lookup tool being posted up on our website and being available for providers. One of the pieces of our system implementation is a data warehouse that is built on the back end, and that data warehouse won't go live for like 3 more weeks. And so when that coverage and reimbursement lookup tool, when the data warehouse goes live, so there's some additional programming we are doing on our back end to take the PRISM data and use it. And when that goes live, our new coverage and reimbursement tool will be posted on that same hyperlink at that time. So what you'll see is our older system with red text saying that after, I believe it's March 13th, that the policy and the data will be relevant up to March 13th. And then there will be a new coverage and reimbursement resource for you that will be available, I think, after mid to late April. I think, Shandy, did I miss anything with that, or did I get all the detail?
No, you did great. Thank you.
Okay. Yep. Great. Thanks. Any other questions? Great questions so far. Okay, Melissa, if you don't mind just showing the page quickly, what we wanted to just like display for you now is the provider resources that we have, just to orient you to some of the online resources we have available. And then Melissa, if you just want to walk through a little bit of this.
Sure. Are you guys seeing what I'm sharing on my screen?
We got it.
Perfect. So this is just like the home page, the home base page from Utah Medicaid. So when you come on here on the right hand side, you'll see PRISM. So you just click on that link, and I've already got it opened up here. So there's a lot of links at the top to take you, to commonly probably questions or areas where you probably would be commonly having questions. So we have the prison provider training link here. That will take you to, I'll just go ahead and click on it, those trainings that Jen was talking about that are live, as well as they are going to be adding the recordings here, I believe, as well. So you can see the calendar here for upcoming ones. Obviously, most of them have already occurred. And then down here, we have the provider e-learning trainings. They are organized by category. If we go back to that home page for the PRISM support, you can see we have the PRISM FAQs and guides here. If you have questions, we have the contact information for PRISM support. The PRISM portal access link can be found here. If we scroll down, there's just a background on this PRISM project, talks about the system freeze, claim submission, and that important notice that paper claims will no longer be accepted. More helpful resources down here. There are important dates and timelines. Again, we have the provider trainings linked. The Medicaid information bulletin articles that are sent out. We have the ones that pertain to PRISM linked here, so that's a super helpful resource. And then a section regarding multi-factor authentication and resources on how to access that. Is there anything you wanted me to click on specifically, Jen?
No, that's great. Just to
Okay.
give an overview of the online resources that we have. And then if there aren't further questions, we did want to just update you. And Shandy, I'm wondering if you would mind just talking to a couple of the provider specific around provider enrollment and some of the couple items that we're looking at around identifying a specialty and then ordering and referring providers. Would you mind just walking through what our current system does, and even though our policy is there, what our new system will require, just as a highlight to the group here?
Sure. So let's start with just provider enrollment general related to retro enrollment. So in the past, well, and our provider enrollment system has been up for some time, and so that might not be new to the folks that are using that system. But we have in the past allowed a retro enrollment approval up to 4 months because we understand that there are challenges with providers and getting things in quickly and process wise, and so there's been a 4-month allowance for that in general. Anything over that usually will require a hearing process unless there is a specific reason associated to maybe a discrepancy in our system or a cause that an issue that caused your delay that wasn't within your control. Those are the kinds of things that we are looking at individually to exceed that 4-month. With PRISM and the challenges that we understand providers are having with some new policies that have been set in the system to edit. And again, I don't think any of these are outside of like national coding guidelines or expectations for credentialing and processing enrollment. It's just the MMIS system may not have been as restrictive in denying claims for reasons that we are now looking at in PRISM. And so providers that have not chosen a specialty or subspecialty, which these are things that are, your categories of service, like a physician may have multiple categories of service, rural health clinics, there's a scope of services you're providing to your folks. And we have to know that in order for, say, dental codes to be paid, that you have to have chosen a subspecialty that's dental related. Physicians, if you have that as well, there could be multiple. And we have some providers that have not chosen a specialty at all. And those situations will cause the claim to deny. until a modification on their enrollment is submitted and processed so that those claims can go back through and see that there is a specialty. Let's see, did that answer your question for the one section? And then we have the ordering and referring and prescribing.
Yeah, so I think that's great. And I just want to call out again that if you have not gone into our system, our old system saw many of our providers, wasn't able to kind of go down into specialty type. Our new system has a great layout, which is really able to identify much more streamlined work that way. But it's important as we looked at different providers, even we were looking at pharmacy claims and pharmacy providers and dental providers and all other providers. I know we had a nurse practitioner on the call today. If you have not gone in and identified a subspecialty in the system, you need to do that so that claims can process. Okay. We have put out several notifications on this over the last year, but we're now at the point now where claims won't pay. And so we really do want to encourage you to do that. We'll get your work. We have teams that are trained and they are doing provider enrollment requests now. And we're as our system comes out of the freeze and we're able to get back in, those teams will immediately get to work and updating and modifying these requests. But we want to just make sure you're aware of that. So thanks, Shandy. I'm sorry. I'm saying what you said, but I'm just emphasizing it again that if you haven't gone in and really identified a specialty, it's necessary for you to do that in order for you to continue to work in our system. And then the other area, Shandy.
Yes, which is ordering, referring, and prescribing. And although those providers are not billing us directly on the claim that's being submitted to us, there is additional editing that you may not have seen before on certain claim types. So in the past, we've always required an ordering or referring or prescribing on, pharmacy claims or lab claims, x-ray claims. And now there's going to be more claim types that will require this that you may not have been seeing these denials before. Home health, let's see, durable medical equipment, things like that. And I don't know if that really pertains to the group or the audience here today, but just as an awareness, those providers who are ordering, referring, and prescribing also have to be known to our system in order for the claim to be paid to the provider who is doing the service. And we will retro enroll those providers as well. It'll be a little bit, let's see, we are going to extend, Jen, do you want me to outline what we decided today?
Yeah.
So in the fee-for-service world, which is the area that comes through my group, ordering, referring, and prescribing, we will allow a 12-month retro enrollment. For those who are not ORP providers, and we will grant a 7-month window of retro enrollment, and anything beyond that would either go through the hearing process or need to be brought to Jennifer's attention for a decision.
Okay, thanks, Shandy.
Mm-hmm.
Okay, are there any other questions that you have for us today? Yes, all prior authorizations that are submitted to fee-for-service are being done in PRISM. So yes, I know that we do have some managed care dental in that runs through our managed care organizations for Premier and our other dental provider, those would still need to go through those managed care dental providers. But if it is for a fee-for-service member, it would be sent right through the PRISM system. Yes. Any other questions we can help you with? Okay, that will close our, okay, hold on. Pre-auths for MCNA and Premier, yes. So the pre-auths for MCNA and Premier go to the plan. That is correct. Yeah. During the freeze, we received to be determined as the PA number. Will we receive an update with the number that we have for research? Answer to this question is yes. Our team actually was able to get in this week and begin entering the prior authorizations that were used as a workaround during the freeze. When our system goes live, you will receive a number. Your prior auth is being entered right now this week. That may have been processed as in a roundabout way during the freeze. Those are being entered into the system now. When the system goes live, you will see a number assigned to your prior authorization request after our go live date on April 3rd. So yes, you will. Thank you for the question. Any other questions we can help you with? Okay, if not, our email box is open. We have people working them now. So if you have questions, go ahead and submit them to that Prism email box. Use our resources. If there's outstanding issues or problems that you encounter, feel free to reach out to us. We're happy to help you and want to partner with you in making this successful. So we're so glad that we could have this opportunity today. Casey, thank you for setting this up in such a quick fashion and allowing us the opportunity to come and meet with our rural providers. We appreciate all you do for us on behalf of the Medicaid program and the members that we serve. Thank you so much for working with us. We know it's a change, and so we're here to work with you through that change. We just want to thank you very much for the work you do, and thank you for the time that you gave us just now. So, okay, thanks everyone.
Thank you so much, Jen. Thanks everybody for participating today.
You're welcome. Thank you.